is most important in giving instruction to this client? Select the correct answer choice. Choice A, limit high carbohydrate intake. Choice B, limit salt and fluid intake. Choice C, limit high fructose intake. Choice D, limit caloric intake. The correct answer is limit salt and fluid intake. Clients with stage A cardiac disorders should be taught to focus on eliminating risk factors by initiating therapeutic lifestyle changes. Limiting salt and fluid intake is correct because this will help in reducing fluid buildup, pedal edema, and excess body water to decrease ventricular preload pressures. The other choices will have little effect on ventricular preload. Which of the following best illustrates the evaluation step in the nursing process? Choice A, reassessment of pain after pain medicine. Choice B, assessment of lung sounds on a new admission. Choice C, auscultating and palpating a patient's abdomen when he complains of new abdominal pain. Choice D, asking the patient if there is anything else they need before the nurse leaves the room. The correct answer is reassessment of pain after pain medicine. The evaluation phase of the nursing process involves measuring the effectiveness of interventions implemented in the plan of care, including reassessing pain after medication. The proper sequence of events in the nursing process is performing an assessment, assigning a nursing diagnosis, planning, implementing, and evaluating. The nurse's assessment gives the nurse the information needed to identify problems affecting the patient or problems the patient is at risk for developing. The nurse can then develop a nursing diagnosis and plan appropriate interventions to prevent or resolve the problem. The nurse should involve other members of the interdisciplinary team as necessary to implement the plan of care. After implementation, the nurse must reassess the problem to identify whether the interventions were effective. Incorrect options include assessment of lung sounds on a new admission or assessment of the abdomen when there is a new complaint of abdominal pain are in the assessment phase of the nursing process. Asking if the patient needs anything else before leaving the room is a good way to ensure that the nurse has met the patient's needs while there, but is not an effective measure of interventions. A nurse on a busy medical surgical floor has a certified nursing assistant assigned to her patients. The nurse has delegated to the CNA to obtain patient vital signs. The CNA reports to the nurse a blood pressure reading of 82/40 on a patient with atrial fibrillation. The nurse should do which of the following first? Select the correct answer choice. Choice A, go assess the patient and recheck a manual blood pressure to verify the accuracy of the blood pressure. Choice B, wait until the next set of vital signs to reassess, since this reading is acceptable in atrial fibrillation. Choice C, call the doctor to report the blood pressure reading and await new orders. Choice D, increase the rate on the patient's IV infusion. The correct answer is go assess the patient and recheck a manual blood pressure to verify the accuracy of the blood pressure. Many hospital floors have CNAs trained to obtain and record patient vital signs. This does not diminish or eliminate the nurse's responsibility for patient care regarding vital signs assessment. The CNA has the responsibility to report any abnormal vital signs to the nurse. The nurse then has the responsibility to verify the results. In patients with atrial fibrillation, blood pressures that are taken with a machine are often inaccurate due to the patient's irregular heart rhythm. In this instance, the nurse should reassess the blood pressure with a manual blood pressure cuff to verify the accuracy of the result, and then notify the doctor if the BP is still out of the accepted range. A nurse on the cardiac telemetry floor is preparing to admit a new patient with complaints of chest pain and shortness of breath. The nurse may delegate to the certified nursing assistant which one of the following. Select the correct answer choice. Choice A, initiation of intravenous access. Choice B, documentation of the patient's medical history. Choice C, obtaining the admission assessment. Choice D, obtaining the admission weight. The correct answer is obtaining the admission weight. Each hospital has policies and procedures which outline the task that a certified nursing assistant, CNA, may perform. A nurse may delegate the task of weighing patients and obtaining and recording vital signs. The documentation of a nursing admission history and physical assessment are the nurse's responsibility and may not be delegated. The initiation of intravenous IV access is also the responsibility of the nurse and should not be delegated to personnel who have not had specialized training in performing the task. Which selection most accurately depicts the nursing process? Choice A. The nursing assistant reports a reddened area on an immobile patient's coccyx. The nurse directs the nursing assistant to apply barrier cream to the area and reposition the patient every 2 hours. Choice B. The nurse assesses that an immobile patient has a reddened area on her coccyx that is relieved by removing the pressure. The nurse directs the nursing assistant to reposition the patient every 2 hours and to notify the nurse of any changes in the patient's skin integrity. The nurse passes on this finding to the next shift and report. Choice C. The nurse assesses that the patient is not independently repositioning herself in the bed and has slightly reddened area on her coccyx that improves when pressure is relieved. The nurse determines that the patient is at risk for pressure ulcer. The nurse creates a plan of care that includes repositioning the patient off the pressure points every 2 hours. The nurse communicates the plan of care with the nursing assistant. The two reposition the patient every 2 hours through the shift. The nurse reassesses the patient's coccyx every 4 hours and documents the assessment in the medical record. Choice D, the nurse and nursing assistant reposition the patient every 2 hours per unit protocol. The nurse assesses a reddened area on the patient's coccyx. The nurse applies barrier cream to the patient's coccyx. The nurse reports to the oncoming shift that the patient is starting to have some breakdown on her coccyx. The correct answer is the nurse assesses that the patient is not independently repositioning herself in the bed and has a slightly reddened area on her coccyx that improves when pressure is relieved. The nurse determines that the patient is at risk for pressure ulcer. The nurse creates a plan of care that includes repositioning the patient off the pressure points every 2 hours. The nurse communicates the plan of care with the nursing assistant. The two reposition the patient every 2 hours through the shift. The nurse reassesses the patient's coccyx every 4 hours and documents the assessment in the medical record. The proper sequence of events in the nursing process is assessment, diagnosis, planning, implementing, and evaluating. The nurse's assessment gives the nurse the information needed to identify problems affecting the patient or problems the patient is at risk for developing. The nurse can then develop his or her nursing diagnosis and plan appropriate interventions to prevent or resolve problems. The nurse should involve other members of the interdisciplinary team as necessary to implement the plan of care. After implementation, the nurse must reassess the problem to identify whether the interventions were effective. The other choices do not include the 5 steps of the nursing process. Additionally, the nurse cannot delegate an assessment or reassessment to the nursing assistant. Which is the correct order of the steps in the nursing process? Select the correct answer choice. Choice A, assessment, diagnosis, planning, evaluating, implementing. Choice B, assessment, planning, diagnosis, implementing, evaluating. Choice C,